The Member Recognition Awards were established by the Kansas City Medical Society in 2015 to recognize high-achieving physicians who go above and beyond in their profession and community. The Rising Star Award is presented to a KCMS member who has made significant contributions to medicine, their practice, or to the society early in their career. The 2018 recipient is Dr. Christine Park White. Dr. White is with Johnson County Pediatrics and Shawnee Mission. As a brand new board member in 2016, she was immediately faced with discussions and negotiations of a possible merger of two 130-year-old local medical societies. She rose to the occasion to help lead the historic merger of three nonprofit entities, as well as the Weijo Medical Society and KCMS joining forces. This year, she served as the first treasurer of the new organization.
The Weijo Society involved me very quickly on their board of directors because number one, there was an opening, and number two, I had attended the KMS meeting and was pretty passionate about a couple of ideas and problems going on in medicine, and really wanted to get involved in something where I could affect change. I believe that physician camaraderie is important in medicine today because there are so many outside factors that are trying to control medicine and trying to control physicians and trying to control what happens with patients and their health care. Physicians don't realize the amount of power that they have. We are respected in our communities, both locally and nationally, and we really need to wake up to that and join together to try to improve our lives, but also the lives of our patients and healthcare in general. And as a group, we can make a bigger change than just as individuals. Taking care of kids is fun because they do typically get better, so that's very rewarding. The other thing though is in pediatrics, I have a true opportunity to get these kids as babies or as young kids and train their parents and train them in healthy habits so that they will grow into healthy adults and hopefully live long, healthy lives.
The Patient and Community Advocate Award recognizes a KCMS member who has made significant contributions to helping patients with access to care or improved quality of care. The 2018 recipient of the Community and Patient Advocate Award is Dr. Nicholas Comninellis. Dr. Comninellis is an advocate of patients not just in our community, but around the globe. He's the founder and president of InMed, an organization committed to assisting the most disadvantaged people on Earth through inspiring and equipping the next generation of healthcare professionals. He was recognized as the 2009 United Nations World Citizen and the 2015 University of Missouri Kansas City Alumnus of the Year.
So my role is profoundly influenced by compassion. When people go into healthcare, they usually have wonderful ideals of serving the poor and finding a cure for cancer, and then it gets beat out of them by debt, by workload, by ungrateful people. Physicians start turning away from the virtues that drew them into the field. I want to turn that around and bring us back to those pure desires that brought us in here in the first place. And one way to do that is to intentionally seek out the people who are most on the margins of our society. The elderly, the poor, the disabled, the non-English speakers, the immigrants, those who do not have access to all the benefits that we enjoy. And by intentionally aiming to serve those people, it brings us back to those virtues that drew us into this field. All of us know the phrase, we sit on the front row seat of the stage of life, and it is so incredibly true. And by appreciating the drama that is unfolding before us, we come to appreciate also some of the greatest rewards of the field.
The Innovation Award recognizes a KCMS member or physician group practice that has led innovation in their practice or in the delivery of healthcare. This year, the award recipient is Dr. Dan Durrie, an ophthalmologist and founder of Durrie Vision. Dr. Durrie was one of the first surgeons in the United States to perform laser vision correction and has been involved in the development of nearly every refractive procedure and technology in use today. He discovered intraoperative aberrometry, which became a success story in refractive cataract surgery, improving patient outcomes, and eventually became WaveTech ORA technology. Dr. Durrie's development of WaveTech has been honored with the AAO Innovation Award and the OIS Innovation Award. As a way of giving back to the community, Dr. Durrie is the founding member and medical director of Focus on Independence, an organization dedicated to providing no-cost vision correction surgery to people with spinal cord injuries.
Yeah, I'm Daniel Durrie, and I'm an ophthalmologist called Kansas City home. I've been here for almost 30 years. And what really brought me here was the innovation in medicine that's so well known in Kansas City. One of my mentors told me to really never stop teaching. So I've had fellows that spent a year with me for the last 35 years. And I think that's really been one of the keys, because if somebody's going to spend a year out of their life at an important time with you, you better be ahead of your game, you better know what's going on, or otherwise they're wasting their time. So I think that I give a lot of credit to the great fellows I've had over the years that have always stimulated me to go out and find the new stuff and work with industry. Oh, I think that the innovation, all the major things in innovation have come from physicians and then go to industry. And over the years I've seen that slip a little bit, that people kind of sit back and kind of get things that industry is teaching them rather than the other way around. So I think that all of the major breakthroughs that try to hit the unmet needs in medicine that we see as patients, we need to look for them and be feeding that to industry. Well, I think that I've been really lucky, and I moved to Kansas City when I was 40, and I'd been practicing for a while and doing innovation, but I really needed an environment like Kansas City to allow it to really grow. And a lot of people don't know how Kansas City ranks nationally and internationally in medicine innovation. But it's just a great place, and I think I've been really lucky to be here, and I try to stimulate that the people that I have some exposure to in teaching.
The Community Service Award recognizes a KCMS member, practice, or facility that has served in community leadership or made a significant contribution to their community. The recipient this year is North Kansas City Hospital for donating services to over 1,500 MetroCare patients in the past 10 years.
At North Kansas City Hospital, our relationship with our physicians is based on wonderful mutual respect and trust. And we have found that that relationship fosters the highest quality clinical care and builds a wonderful, wonderful place to be a patient. I believe we started participating in the program because our physicians learned about it and felt that it was a very meaningful way for us to be able to meet the needs of patients who otherwise didn't have access to great medical care.
When I think about healthcare and physician leadership, it's always been important, but probably never more than now. With the changing healthcare landscape, physician involvement in the discussions and solutions that we're going to need to make in the future are very important.
So I've been privileged to work for North Kansas City Hospital this is my 27th year, so I've just passed my 26th anniversary. So I believe that it's one of our strategic pillars is to, fulfill the needs of the community and provide community service, and that is the way that I can do that the best. And I do believe in serving where you live or where you work, and all of the boards that I have served on really do mean a lot to me. And then I also think it makes you a more well-rounded person to give back.
It's more about to me the society and what they're contributing and doing for physicians and communities and hospitals and bringing all those entities together, and less about. There's a financial implication, but it's more about patient care. It's more about taking care of the patients in our community.
It's been a real privilege over the years for North Kansas City Hospital and our physicians to collaborate and be a partner with the Kansas City Medical Society. And through its innovations and growth, we have been able to further our mission and collaborate with physicians, not just at North Kansas City Hospital, but throughout the metropolitan area. And that has brought an additional information and dynamic to our health care that has helped us keep the health of the community at our center.
New this year, the Kansas City Medical Society would like to present an Exemplary Leadership Award to Drs. Dick Warner and Art Snow for over 20 years of service and leadership at the Kansas Medical Society and the American Medical Association.
I'm Dick Warner, and I am an AMA delegate from the Kansas Medical Society, and I'm a member of the Kansas City Medical Society. Carryover from the old Johnson County Society, of which I've been a board member and a past president. Well, there have been many things that are memorable to me. I will share one in particular. I had become a member of the Kansas delegation to the AMA, and as I spent some time there, kind of came to know who people were, and one in particular interested me was a gentleman named Ed Annis. I don't know that people much remember now who Ed Annis was, but he was the president of the AMA in 1962, and he was the most effective spokesman for the AMA in opposing what eventually became the Medicare legislation. And his great concern was that this legislation would lead to a government bureaucracy being interposed between the patient and the doctor, and led the fight to keep from passing that legislation. Well, and this is not just doctors. I think all of society benefits from what are called associate societies, associate groups. Without that sort of thing, then you're left with an individual and a government, and that's not exactly a fair proposition. I have made a number of close acquaintances and good friendships over the years, and I'm always glad to go to a meeting and see the people and hear what's going on. This is how I kind of know what's going on in the world of medicine, is by what I can pick up at the various meetings that I attend.
I chose to dedicate a lot of my professional time to playing various leadership positions in the American Medical Association and the Kansas Medical Society, because I think that's part of the profession. I think this is something physicians are obligated to do as part of their professional responsibility to provide care to patients, and that means working with professional organizations in order to improve medical care for patients, for the community. In order to provide the care for a patient, there's so many things external that interact with our relationship with patients when we see them in the office. And it's our duty and obligation, as I've mentioned before, I think professionally, to do everything we can to improve the care we can deliver patients. And that means getting out in the world, operating through your organization where you have strength in order to help with the political forces that are playing such an important role in our world today. Well, my favorite part of being involved in medical organizations, I think, is the camaraderie that comes from meeting with other physicians, being with them, having a similar goal in the medical societies.